President Clinton is working on a plan to reform the U.S. healthcare system. But it's going to be a tough sell. And Jeff Levine reports a guide intended to help Congress promote it is already generating controversy.
Freshman House member Leslie Byrne was one of those on the receiving end of the new 47-page White House Guide to Healthcare Reform. Possible working title, Everything You Wanted to Know About the Clinton Plan That You Were Afraid Your Constituents Might Ask.
And if this system becomes incomprehensible and impossible to sell, and negative in terms of cost impact.
Right. Then I don't want it.
Yeah.
Byrne believes the paper is useful, particularly since the package could be a hard sell.
It is a very complex plan, and one of the things that concerns me the most is that the more complex the plan, the harder it is going to be to explain it to people.
A supporter of the president's budget package, Byrne is sympathetic to his health care reform effort. As outlined in the Guidebook, insurance companies are singled out as a villain for picking the healthiest people to cover. The solution, universal coverage and set rates to keep costs down. A suggested fill-in-the-blank speech in the package warns about the high cost of doing nothing. The insurance industry is angry about the White House paper.
We were very surprised and disappointed to see how negative the tone was about the insurance industry. The insurance industry is being portrayed as the sole player responsible for all the problems. It's simply not true.
But a Democrat who chairs a key House subcommittee says the industry must change.
Again, the insurance companies are trying to avoid covering people, and that costs money. There's a lot of administrative overhead that's just wasteful, and it seems to me we can eliminate that.
Meanwhile, back in Congresswoman Byrne's suburban Virginia district, constituents are waiting for the president's reform plan with interest and concern.
The overall cost will come out of the middle class, and it will benefit the unemployed and the illegal aliens.
I don't know all the details, but I know that the main point is to insure the 37 million uninsured people, which I think is a good idea.
The White House hopes that members of Congress will use this health care guide to chat up the plan during the recess. Then the really hard sell is expected in late September. That's the latest release date for the reform package. Jeff Levine, CNN Medical News on Capitol Hill.